COVID-19 can be characterized as a pandemic.
So here we are. We're sitting 5 years, literally, since that life-changing announcement. On this day back in 2020, the World Health Organization declared COVID-19 a pandemic. It was the day after that Governor Charlie Baker, then the governor of Massachusetts, declared an emergency here in Massachusetts. And as you know, it led to lockdowns, it led to social distancing, it led to testing, it led to more. Joining us now is Dr. Todd Eller, Chief of Infectious Diseases at South Shore Health. Anecdotally, honestly, and this is true, I was standing right there, and our assistant news director, Jerry Warmo, said, go on the air and read the script. I looked at the word pandemic, and I turned back to him. I said, pandemic? And that's what he said, pandemic. It's just...
Once in a century.
Once in a century. So you studied different pandemics when you were in school, right? But until COVID-19, you had never lived through one. Share with us the moment in 2020 when you realized, you know what, this is real and this is it.
All right, so it was literally 2 days from now, 5 years ago.
Yeah.
I get a call from my head of employee health. And it was like literally a moment when she said, holy crap,
yeah,
something's wrong.
Yeah.
You know, there were 40 staff members that were out because of a respiratory illness.
40?
In the middle of March.
In the middle of March.
That's just unheard of.
So let's take a look at the toll so far. And worldwide, there have been, what, nearly 778 million cases, 7.1 million deaths. Here in the United States, 103 million cases and 1.2 million deaths. Those are large numbers. Is there one patient that you might never forget?
The same day I got the call, I get a call about a young, middle-aged man, otherwise healthy. And he was basically started fighting for his life, needing more oxygen. His chest x-ray showed whiteout in both lungs, double pneumonia. And he was brought up to the intensive care unit, quickly intubated, meaning put on a breathing machine.
Right.
And I looked at him and I said, this is not the flu, this is not RSV, this is something else, this is COVID, and we have to get this patient transferred quickly or he's gonna die. And fortunately, an academic center accepted him. He stayed intubated on that breathing machine for more than a month. He needed more than that.
Sure.
He was dying except
Right.
for an artificial heart-lung machine is what ultimately saved his life. And it was just amazing, the collaboration.
Right.
But I remember thinking, wow, we are in trouble. This is something that's not like what we see. This is like what SARS must have been like back in the early 2000s. But we didn't see that in the United States.
Right. So if there is another pandemic during our lifetime, do you think that if there's anything we might do differently? Remember the social distancing, the mask wearing, the isolation. Is there anything that we would do differently?
Look, we're in a much better place because we have better platforms. We can get vaccines out quickly, but of course we made a lot of mistakes. We kept the kids out of school for way too long. We realized late that this was a disease that was killing elderly and patients with comorbidities, but the young people did really well. So I think we have to, there's so many lessons to be learned, and I think, one of the biggest regrets for me is how much COVID divided us.
Yeah.
But at the same point, there was a lot of collaboration as well. So it really is a tale of two cities, and hopefully we don't have to deal with this soon.
It's been a remarkable 5 years.
Yeah.
Dr.
It's been
Steve,
great working with you too.
It's great working with you, man.
Yeah, you guys have been amazing.
Great, you're terrific.